Welcome to this channel. Today we're going to discuss the physiological changes during pregnancy. Specifically, we're going to look at an overview of the bodily adaptations during pregnancy. But before we get started, if you are new here, make sure to hit that subscribe button and turn on notifications so you never miss out on our latest health education videos. Let's get into it. The physiological changes that take place in the body during pregnancy are due to effects of specific hormones. These adaptations protect the woman's normal physiological functioning. They meet the metabolic demands that pregnancy imposes on our body and provide a nurturing environment for fetal development and growth. The woman's psychological state is also affected by hormonal changes, which interact with other external factors and influence our transition into motherhood. Therefore, it is important to understand the physiological changes that take place, as they can help you understand the potential psychological effects they may have on a pregnant woman. Okay, now we are going to discuss the physiological changes that affect the following body systems: the reproductive system, the cardiovascular system, the endocrine system, the skeletal system, the alimentary system, respiratory system, urinary system, integumentary system, and the central nervous system. So let's start by looking at the reproductive system. So let's start by looking at the uterus, specifically the body of the uterus. So the body of the uterus begins to develop in order to provide nutrition and ensure a protective environment in which the fetus is nurtured. Then the endometrium assumes the name decidual, which is during pregnancy. So you find that the endometrium is referred to as decidual during pregnancy. So estrogen and progesterone produced by the corpus luteum cause the decidual to be thicker and richer and more vascular at the fundus. It is less vascular and thinner in the lower pole of the uterus. The decidual provides a glycogen-rich environment for the blastocysts until the trophoblastic cells begin to form the placenta. When the placenta has been formed, it produces its own hormones. Prostaglandins are also produced during labor from the decidual, which enhances labor. In the myometrium part of the uterus, two major changes are going to take place. There is going to be hypertrophy and also hyperplasia. Hypertrophy refers to the increase in the size of muscle fibers, and hyperplasia refers to the increase in the number of muscle fibers. So this is due to the effect of estrogen, which is a growth hormone. The uterus will grow in the first 20 weeks. Thereafter, it will stretch to accommodate its contents. The uterus increases in weight from 60 grams to 900 grams. The uterus also increases in size from 7.5 by 5 by 2.5 centimeters to 30 by 23 by 20 centimeters. These dimensions, however, vary depending on the age and parity of the woman. The uterus can stretch because of progesterone, which relaxes the smooth muscles. At 8 weeks of gestation, the uterus generates small waves of contractions known as the Braxton-Hicks contractions, which are usually painless and last approximately 60 seconds. At the end of pregnancy, the Braxton-Hicks contractions change in intensity and becomes the contractions of labor. During labor, the muscle layers become more differentiated and organized in expelling the fetus at term. The changes in terms of blood supply. What is going to happen is that the blood supply to the uterus will increase to match the growth and needs of the functioning placenta. There is development of new blood vessels caused by estrogen, which form a tortuous network through the uterine walls. As the uterus grows, the muscles stretch and become convoluted in the third stage of labor. Let's look at the changes in terms of the uterine shape. The upper part of the uterus enlarges due to effects of estrogen. The uterus shape changes to a globular shape in early pregnancy to prepare for fetal growth and to accommodate the increased amounts of placental tissue and liquor arming. This causes pressure on pelvic organs. The lower part of the uterus consists of the isthmus, which softens and elongates from its original 7 millimeters until 10 weeks of pregnancy, when it measures 25 millimeters. Let's now look at the changes that take place in relation to gestation age. So at 12 weeks of pregnancy, the uterus is no longer anteverted and anteflexed. The uterus rises out of the pelvis, becomes upright, and rotates to the right due to the pressure of the pelvic colon that occupies the space in the left part of the pelvis. It measures 1/3 of the body of the uterus at term. The fundus of uterus may be palpated above the symphysis pubis. At 16 weeks of pregnancy, the fundus of the uterus assumes a dome shape. As the fetus is growing, it puts on enough pressure on the isthmus, which causes it to change the shape to a more spherical shape. The isthmus and the cervix develop into the lower uterine segment, which is thinner with fewer blood vessels and muscles, a site for most of the cesarean sections. At 20 weeks of pregnancy, the uterus is ovoid and has a thicker, more rounded fundus. The fundus of the uterus can be palpated at the level of the umbilicus. The fallopian tubes, which appear to arise from the lower level of the uterus, continue to rise in the abdomen, restricted by attachment to the broad ligaments, and become more vertical. At 30 weeks of pregnancy, the lower uterine segment can be identified, though it is not complete. It can be defined as a portion lying below the refraction of the uterine fold of the peritoneum and above the internal os of the cervix. At 36 weeks of pregnancy, the uterus reaches the level of the symphisternum. The fetus sinks into the lower pore of the uterus because of the softening of the tissue of the pelvic floor. Together with good uterine tone and formation of the lower uterine segment, lightening is formed. Let's now look at the cervix. So the cervix secretes thicker and more viscous mucus during pregnancy and forms a cervical plug called operculum, which provides protection to the fetus from ascending infection. The changes are brought about by increased vascularity, slight hypertrophy and hyperplasia, which also define the probable sign of pregnancy. Estrogen increases cervical vascularity. So through a speculum examination, the cervix appears purple. In late pregnancy, the cervix softens in response to increasing painless contractions. let's discuss the changes in the vagina. So the changes in the muscle layer and the epithelium are due to estrogen. The muscle layer's hypertrophies changes the surrounding connective tissue and allows the vagina to become more elastic. This enables it to dilate during the second stage of labor and receive the descending fetal head. Pregnancy hormones prepares the vagina for stretching during labor and childbirth by causing the vaginal mucus to thicken, connective tissue to loosen, and the smooth muscles to increase in size. It also allows the vaginal vault to lengthen. Now, there's also a marked desquamation of the superficial cells of the epithelium, which increases the amount of normal white vaginal discharge, which is called leukorrhea. Now, leukorrhea is simply a white or slight gray mucoid discharge with a faint mast odor. The pH of the vaginal fluid is more acidic during pregnancy, ranging from 3.5 to 6, and this is as a result of increased production of lactic acid caused by the lactobacillus acidophilus acting on the glycogen in the vaginal epithelium. Let's now discuss the last part of the reproductive system, which is the breast. So, changes that take place are due to increased hormone activity. The nipple is prepared for subsequent feeding. Estrogen develops a duct system, whereas progesterone develops a glandular tissue. The breast enlarges due to increased tissue growth, fat deposition, and blood supply. Let us now discuss the changes that take place in the cardiovascular system. So the cardiovascular adaptations protect a woman's normal physiological functioning and meet the metabolic demands pregnancy imposes on her body and provides for fetal development. During pregnancy, the heart changes. What happens is that the heart increases in size. This is due to increased workload and may be displaced upwards and to the left side, rotating anteriorly because of the increasing pressure of the growing uterus. When it comes to the cardiac output increase from 5 to 7 liters per minute by late pregnancy, affected by an increase in resting heart rate about 15 beats per minute by the end of the pregnancy and an increase in blood volume. The total amount of hemoglobin increases during pregnancy, but the mean cell hemoglobin is slightly lower, and then you're going to find that the plasma volume increases to approximately 50% above non-pregnant values to provide extra blood flow for placental perfusion at the choriodecidual interface. There is large increase in plasma volume compared to red blood cell mass, and this leads to hemodilution, where there is a lower hemoglobin level, hematocrit, and red cell count referred to as physiological anemia. It is more apparently between 32 to 34 weeks of gestation. Blood pressure remains the same or may drop slightly in the first trimester, and it reaches its lowest in the mid-trimester. Towards the end of pregnancy, it returns to the level of the first trimester. So changes in the mid-trimester causes fainting. Therefore, women should avoid superimposition, which causes pressure on the vena cava. Cardiac output is reduced and can also give rise to fainting. Let us now discuss the changes that take place in the endocrine system. So during pregnancy, there's an increase in most of the hormones of the endocrine system. The pituitary gland enlarges by 50% and its weight increases by 135% during pregnancy, increasing its production of hormones. Production of prolactin begins to increase early in the first trimester and increases progressively to term. It promotes secretion of milk from the breast. However, the high levels of estrogen and progesterone inhibit lactation in the breast tissue until after birth. The posterior pituitary gland releases oxytocin throughout pregnancy. The release increases in an amount as the fetus grows. The hormone stimulates uterine contractions, but the high levels of progesterone prevent contractions until closer to term. Oxytocin also stimulates the let-down reflex after birth in response to the infant sucking at the mother's breast. Human chorionic gonadotropin, which is HCG, is produced by the trophoblast and is detectable within maternal circulation within days of implantation. It forms the basis of pregnancy test. Its function is to maintain the production of estrogen and progesterone by preventing degeneration of the corpus luteum until the placenta takes over. It can first be measured in the bloodstream 8 to 9 days after ovulation. Estrogen increases vascularity, causing vasodilation. It also causes fat deposition in subcutaneous tissue over the maternal abdomen, back, and upper thighs. Estrogen also causes laxation of the pelvic ligaments and joints. It has an inhibiting effect on prolactin and therefore prevents lactation until after delivery. Progesterone is essential for maintaining pregnancy by relaxing smooth muscles, therefore preventing uterine contractility and miscarriage. Relaxing has a relaxing effect on the pelvic ligaments. Levels of thyroid hormones also increase, and the thyroid gland itself may also increase in size, a condition known as goiter. Let's now discuss the physiological changes that take place in the skeletal system. There is relaxation of pelvic joints due to hormonal changes, that is, estrogen, prolactin, and progesterone. Estrogen makes connective tissue more pliable, causing joint capsules to relax and pelvic joints to become mobile. Progesterone relaxes and weakens the pelvic ligaments. Relaxing softens the pelvic ligaments in preparation for delivery. Abdominal distension gives the pelvis a forward tilt, decreased muscle tone, and increased weight. The woman's center of gravity shifts forward, causing the development of exaggerated lumbar curve or lordosis, leading to a typical waddling gait. There may be discomfort and backaches in advanced pregnancy. Let's look at the changes that take place in the alimentary system. So the gums become more hyperemic, edematous, soft, and spongy. They bleed easily due to the action of estrogen, which causes increase in vascularity and connective tissue proliferation. The appetite and food intake fluctuate. Some women may have nausea and vomiting due to increased HCG levels and altered carbohydrate metabolism. Let's discuss another system, which is the respiratory system. Oxygen requirements increase in response to accelerated metabolic rate because the fetus also needs oxygen. Elevated levels of estrogen causes the ligaments of the rib cage to relax, leading to increased chest expansion. Expansion of the chest causes an increase in tidal volume by 30 to 40% and an increase in inspiratory capacity. Progesterone causes dilatation of the pulmonary vasculature to increase blood volume. Let us now discuss the changes that take place in the urinary system. A number of changes occur in the urinary system during pregnancy. There is dilatation of the renal pelvis as well as the ureters, which is as a result of relaxation of smooth muscles caused by progesterone. There is stasis of urine because of progesterone, which causes the bladder muscle to become relaxed as well as dilatation of the renal pelvis and ureters. Stasis increases the risk of urinary tract infections. There is frequency of micturition. Tubular reabsorption remains unaltered despite the increased blood flow and glomerular filtration rate. As a result, there's an increase in the clearance of substances and waste products. The protein levels in urine increase during pregnancy. Let's look at another system, which is the integumentary system. So in this system, there is hyperpigmentation of the skin, which is stimulated by the increased levels of the hormone melanotropin produced by the anterior pituitary gland. It is more marked in dark-skinned women and is more pronounced in areas such as the areola, the nipples, the vulva, perineum, and abdomen. Some examples of hyperpigmentations are chromism. So this is hyperpigmentation of the face, usually noticed on the cheeks and the forehead. There is also linea nigra. So this is pigmentation of the linea alba line, extending from the symphysis pubis to the top of the fundus in the midline. The other example is stria gravidarum. So this is where there is rapid stretching of the skin in the abdomen, the thighs, and the breast. It is due to high levels of circulating hormones. Let us look at our last system, which is the central nervous system. So in the central nervous system, the pituitary gland increases in size by 30 to 50% in pregnancy. There is also maternal weight gain, which is attributed to the uterus and its content. The total weight gain is on average 12 to 13 kg. So this is what I had for you. Thank you for watching this video on the physiological changes during pregnancy. I hope you found the information helpful and insightful. If you enjoyed this content and want to learn more about similar topics, please consider subscribing to the channel. Don't forget to like the video and share it with others who might find it useful. Hit the notification bell so you never miss an update. Thanks again and see you in the next video.